part of peel and put it on a paper. It's very easy, very easy. I mean, it's not difficult. We get the sample. And why we do neonatal screening? Why? I'm sure you do for your children. I'm sure, 100%. Because medical doctors, they do all of them. I know because it's my experience. So you will come sometimes. Why we do that? Because for identification of disease, early intervention, reduce morbidity or mortality and family planning and so on, because you want to check your baby first to see whether has got any disease or disorder or not. Without any symptom, just check. You get the samples from him, very easy, and put on the paper and send the paper to the laboratory. What time you do that? Exactly, this is very important. What time? What's the best time? What's the golden time for this one?
2 to 3 days after.
Exactly. Not exactly after birth, because mother's blood is in the baby. Because mother's blood is still in the baby, in baby body. So after 1 or 24 hours is the best until about less than 5 days. Why 5 days? Because sometimes some disorder start to harm the baby exactly after the birth. So if you prevent before that, is the best. I give you some example. So the best one is 2 to 3 days is the golden time. I give you some example for that one. For example, phenylketonuria. Do you know phenylketonuria?
Yes.
From your biochemistry, possibly. What's the problem in phenylketonuria? Phenylalanine. When the baby, after birth, the baby, if you reduce phenylalanine from the food, from the milk, give you the milk without phenylalanine to the baby, you save the baby. Otherwise, the baby suffer from some harmful problem of the disease, such as mental retardation. You understand what I mean? Mental retardation. One of the problem with the patient with phenylketonuria is mental retardation. If you reduce very quickly phenylalanine from the milk, give the baby milk without phenylalanine, not mother milk, not mother milk, just milk without phenylalanine. What happened? You save the baby from mental retardation at least. And other disorder you can see, galactosemia and so on and so on. Many disorder which we can test. The instrument which we use for neonatal or newborn screening is MSMS. That's the instrument. I give you the picture of the mass spec, MS tandem mass spectrophotometry. It's an instrument that we use in our laboratory for newborn screening. Newborn screening we do newborn screening for many disorder, metabolic disorder, especially metabolic disorders, many metabolic disorders, which can prevent, if you do quickly, you can prevent mental retardation. The incidence of these disorders is not very low. Sometimes it's very high. 1 in, for example, 10,000. 1 in 10,000. In Iran, we have 1 million births per year. For example, for one of these disorders, amino acid disorder, is 1 in, for example, 10,000, for example, 1 in 10,000. 1 in 10,000 in 1 million. How many patients you can have in a year? Very easy. Very easy. 1 million. 1 million births per year. Frequency in USA, in Germany, I say in Iran 10 to 1,000, such as this. 10,000, 1 in 10,000, something like that. 1 in 10,000. How many patients you have?
100. 100.
Exactly. 100. It's a lot. It's a lot.
Should we memorize the incidence rates or is it
No, not at all. Just know as an aspect, not in Iran, not in USA, maybe your country is something like that. What I'm saying now is to know about your country and children in Iran and in how many children. I am showing it is important to consider. I understand? It is important to consider. So, this sentence is very important. With this test, a screening test, newborn screening, you can save a life or prevent disability. Do you agree with this one? Okay. But all of the results must be confirmed because they are a screening test. Do you remember I said many times, a screening test must be confirmed with another test. Understand? Because they are a screening test. Okay. Some terminology. I am going to give you some. So far, I said about the screening test. I want to give you some example and some about diagnostic test. Diagnostic test is when we have a symptom. Understand the difference between the screening test and diagnostic. What's the diagnostic test? When we have a suspected condition. I have a pain in my tongue. Understand? When you say, yeah, that's it, because you have the symptom. Golden standard test is the best test standard which you can apply. The most accurate test. The best performing test available. Prognostic test is the test after treatment. We want to see the effect of treatment. You use prognostic test. Again, I want to show you this one. I said about screening tests. Now I'm going to say about diagnostic tests. Diagnostic test. Two diagnostic tests, this one and that one. I am going to explain. Prenatal diagnostic test. Prenatal diagnosis. Prenatal diagnosis involves testing during pregnancy. Is it clear? Okay. To determine if the fetus has got some criteria, condition, or something, genetic disorders. Some applications for prenatal diagnosis. Which kind of application? History of genetic disease in our family. So we have to go for prenatal test. Management of high risk. You did prenatal screening test. You remember PND, NIPT. When we get high risk of NIPT, you go for prenatal diagnostic test. I mean PND. When you have, you remember quad and triple biochemical or DNA-based test, screening test, NIPT. If you have high risk of abnormality in fetus, you have to go for prenatal test, prenatal diagnostic test. Fetal health monitoring, if you are going to monitor. If you have some abnormality, anatomical abnormality, you have to go for that one. Okay. What's the prenatal test? Do you remember that one? Yeah. Remember. So you have the high risk, you have to check. How you can check this and diagnose between these four conditions is prenatal diagnosis test. Prenatal diagnosis, the results of that prenatal sometimes is healthy. You say, okay, your children, your baby, after testing, your baby is fine, go home. It's better than you, father and mother, healthy. Or carrier. You say, okay, your child, your baby, your fetus is carrier, is the same as you, your father and your mother, for example. Or, no, fetus is affected. What's this mean? When we say fetus affected means fetus is a patient. I don't know about your country, but I know in my country abortion is very, very difficult. We need a lot of work to do. I mean, paperwork to sign, many doctors to check, because you are going to kill a live person, alive, the baby. You want to kill the baby. Do you understand what I mean? It's not easy. It's not easy. So in this situation, you want to make a very, very difficult decision. It's not easy decision. To be honest with you, it is definitely a stress, emotional and physical stress for mother, especially for mother and also for father. I have seen the person crying. I mean, always, not always, often, crying after I say, okay, you have to go for abortion. Not only the mother, also his father. Crying, to be honest. So it is a stress. And also sometimes legal. You need a lot of paper for legal. So it's not easy. You must be careful. PND steps. The step of PND, the first one is discussion with healthcare provider, and also you must explain for the patient. You must explain for the patient. Don't forget it. You are a medical doctor. You cannot say, okay, go and do abortion. It's not easy. You have to explain why we should suggest for abortion. You must explain about the disease, disorder, and future of the disorder. It's not easy. So you must explain about the test and also everything, and also discuss the results. You must discuss with the patient. I mean, genetic counseling is this. You understand what I mean? Genetic counseling is this. You have to explain. Otherwise, you will be in trouble. You will be in trouble, not patient. Because in future, if something happened to the fetus, come to you, it's your mismanagement. So be careful, be careful, be careful. 3 times I say about this one. It's very, very serious. How you can do that? We get the sample from amniotic fluid around the baby. We get the sample from amniotic fluid here, or maybe sample from chorion. From chorion, I mean the baby's chorion, fetus chorion. We get the sample from chorion or the sample from this one under sonication, guide of son. Here, the guide. So we get the sample. We get CVS or some chorion based sampling or amniotic fluid. At the age of 12 to 13 weeks of pregnancy, 13 weeks or 15 weeks of pregnancy. Why we don't do these 2 of sampling, fetal blood sampling or fetus sampling? Because it is after 20 weeks. It's useless. Understand? So these 2 is useless. We do that 2 sort of sampling. We get sample from mother, but not for diagnostic test, for screening test. Understand? We check the sample using, you remember I said at the beginning, molecular methods and cytogenetic method for chromosomal checking. We do PCR and different kind of PCR or NGS for molecular problems, and we do cytogenetics such as karyotype F, fish or frozen in situ hybridization or other method to check the chromosomes. Okay. Some points about PND. The first one is the sample when you get is very small amount of fluid, amniotic fluid or CVS. Don't lose it. Don't lose it. And almost the sample, maybe it is contaminated even with mother. Contaminated with mother blood. Is it possible? Yes. And what do you check? You check instead of the baby, you check mother. You say you are carrier, however, the baby is patient. Understand? Stage. Be careful. How we check that one? We use STR, which I will explain. I have written in red here. What does this mean? What does this mean? Why I have written in red?
We should do a test for the parents before we do for the child.
Before pregnancy, before applying pregnancy. Do you know why? Because I can do prenatal prenatal diagnosis test, or prenatal diagnosis, provided that I know the mutation or the problem. Before that, I have to find the problem. Where is the problem? We have 3.3 10 to 9. Which mutation? One mutation can happen. One mutation happen in this one. What is that? Do you understand? Aligned DNA. which part of DNA I have to check. You understand what I mean? Which gene? We have about 30,000 genes. Which gene I have to check? Which one? So before pregnancy, I have to check mother and father. And when I know the problem, I say, okay, go for pregnancy, and I can find the problem in the baby. Is it clear, sir? Is it clear? So, in advance before pregnancy, we have to do that. And that's, don't forget, because you want to do permission for abortion, meaning permission for killing, you have to check in different methods. Limitation for PND is law as said. I said to you in some countries or something, sometimes late onset disorder, we don't know the disease before pregnancy and so on, because the problem happened after age of, for example, 40. Do you know dementia? Yes. Do you know dementia? So dementia happened at this age of about 40, 50 or 60. That's late onset disorder. When they want to do pregnancy, we don't know about that one. Understand? So in this situation, it's sometimes a limitation. Copy number of the gene. Sometimes we have, I said to you, we have different copy number of the gene. We have mutation here. I don't know about other copy number of the genes. So in advance of the pregnancy, we have to know. We have to know about the specific mutation. Sometimes the mutation is unknown. I cannot do anything when it is unknown. So I said to you about PND. Now I am going to say about PGD. Pre-implantation genetic diagnosis. In some countries, PND is not allowed, because the results of that is abortion if the fetus is patient, has got a problem. But what about PGD? PGD is pre-implantation genetic screening or pre-implantation genetic diagnosis, is a genetic test. Look, it is a test tool that allows for a screening of detection of abnormalities, problems in 3 days, just 3 days embedded. Do you know what's that? 3 days embedded. It means before implantation. We do this one using IVF. Do you know IVF? In vitro fertilization. But the point here, we don't have abortion in PGD. So PGD is allowed in all countries. Except, you know where PGD is not allowed for where? I have done it, PGD, for some patients. Do you know who? I don't know. Do you? Is there any Catholic here? Catholic? No? No. I'm Christian Catholic. No? No. Christian Catholic, they are not allowed for PGD. For example, I have many patients from Germany. Germany, in some parts, it's not allowed PGD. Do you know why? Because they say after fertilization, you cannot go for any kind of abortion after fertilization, because they have goes through. in embryo after fertilization. So it's not allowed for Christian Catholic, but others it is allowed for all Muslim, all Christians, and others. Because there is no abortion. It's very important. What's the problem with this method? It's very limited. I mean, they need very expert person, and it is very expensive. Very expensive. Okay. Why should we do PGD? PGD is for disorder which we are not allowed to go for abortion. So we can do PGD for all patients, all disorders, all. But we cannot do PND for some disorders. So I say it's exam. That I give you exam. Usually I give this question in the exam. I say the patient, I say the disorder, you say which method can do that? PGD or PND? Do you know albinism?
Yes.
Albinism. Yeah. The test for albinism. Which test you can apply for albinism? For prenatal testing. PGD or PND?
PGD.
PGD. Who go for PND? Nobody. PND? PND. So, for deafness, PGD or PND? Who is in favor of PND? Who is in favor of PGD? You do nothing, huh? PGD. PGD.
I don't know how can I say this.
You don't do anything. Okay, difference. Let's burst the baby. Yeah. You.
PGD. I don't know yet because I don't know.
Deafness. The baby has got deafness.
PND.
PND, you go for PND or PGD. Which one you say to the patient? Go for PND or PGD?
Go to another doctor.
You said PGD
No.
it's very costly, so PND.
But you are a medical doctor. You must make a decision and say to the patient, which one?
PND.
PND.
PGD.
PGD.
PND.
PND. PGD. Look, let me another thalassemia major. Thalassemia major. PGD, PND. PGD, 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 PND, PGD, PND, PGD.
PGD. PGD.
Oh, PGD. PGD. Okay, let me say, or let me ask why PGD or why PND. When you say albinism, I check the sample, I check the fetus and say, okay, the baby, the fetus, suffer from albinism. Suffer from albinism.
So
Is it allowed to go for abortion?
No.
No.
No? But you said PND? PND is abortion. The results of that is abortion.
It's because here it said PGD for late onset disorder, so I thought.
Albinism is not late onset. When the baby born, you can see you.
Yes, so that's why I thought not PGD. PND.
You said PND, but
Because it's not late
There is
onset.
no force.
yes, but when you get the results of PND, result of the test, saying that, okay, the baby suffered from albinism, you say to mother, go for
No.
abortion? No, because you cannot abort that one. But when you go for PGD, nothing happens because there is no abortion. Understand? Anything which is deafness you cannot abort. But for thalassemia major you can abort. Understand? Whenever you can abort, you can go for PND. However, for thalassemia also you can go for PGD. Doesn't matter. If you have more money, go for PGD. Understand? Is it clear? Okay. So that's it. What about gender selection? Do you know gender selection? Boy,
PND because there is a portion.
is it you go for PGD or
No,
PND?
PND because there is.
Boy or girl? You want? You have children? You? No? You are not married. You are married or not? No.
PGD can detect the gender?
PGD.
Yes, PGD can detect the gender to say boy or girl. I can do that. I have done it a lot. Not can do that a lot. To say boy or girl with PGD or PND.
PGD.
Of course, PGD. You cannot kill the boy or girl. You cannot kill. You cannot abort that one. It's not ethical. It is not religious. It's not allowed according to law. Understand? It's just the only way for that one is PGD. To be honest with you, the most PGD which I have done it in here, many is for gender selection comparing to disorders. Because many people want boy or girl. Yeah. South of Iran. North of Iran, girl. South of Iran, boys. Mainly. Not always. Mainly. So, for gender selection, we do this one. So, the most important part of this slide is this one. PGD is for disorder which we are not allowed to go for abortion. Finished. How we do PGD? How? It's the way. First, during the period, usually a woman release just only one oocyte, usually one oocyte. But if we stimulate that one, we can get 5, 10 oocyte. We can get 10 oocyte from mother and 10 sperm from, or more sperm from father. Inject this one, inject or inject the sperm into 2 oocyte. So after that, we have zygote. Is it right? Zygote. So we have many zygotes in tubes. 10 tubes. I have 10 tubes, 10 oocyte, 10 injection of sperm, and 10 zygote. What this means? It means I have 10 child, not potential child, not now child, not a baby, but 10 baby in tubes. Understand? Potential baby, not baby, the zygote. So what can I do here? I can take one cell. Look at that one. One cell from each one. Each embryo. I can get one cell from each embryo. Look, the first one was get oocytes, many oocytes. Inject a sperm into the oocyte. we get embryo and take one cell from each embryo. Means I have 10 embryos in 10 tubes, take one cell from each and test each cell. What this means if I test the cell and say this is boy, this is boy, this is girl, boy, girl. What can I do? I can say, okay, doctor, transfer, you want girl or boy? Girl. You boy. You want boy. You girl. Okay, transfer girl to the mother or embryo to uterus of the mother. I mean, if you want boy, for example, transfer to boy. It's not boy and girl. We check the fetus or embryo is suffer from disorder or not. This one has got disorder. This one is healthy. Disorder, healthy, disorder. What can I do? Transfer the healthy one into the uterus. Is it clear? That's PGD. Understood? That's PGD. But we check just only one cell, not many, just only one cell from each embryo. That's the system of the PGD. Understood?
When you take just one cell from the embryo, does it affect the embryo growing?
No, doesn't affect. No. Yes. Nothing happens. Because each cell has got potential to go and create one person. Do you understand? Have you seen identical twins?
Yeah.
Identical twins. If you separate this one, you get two because they are stem cells. Understood? They are stem cells. Is it clear? So what we do that we get a cell as from embryo, one cell. We check for chromosomal disorder, or we check for PCR. You know PCR for molecular disorders. Understood? And the results would be transfer the healthy embryo to the uterus. Is there any abortion here? No, because we transfer the healthy one. There is no abortion. Here, we check embryos, 6 embryo, and say, okay, throw it away. This is healthy, throw it away, healthy, throw it away. Is it easy? Understood? Everything? Okay. In this situation, how we get the sample? We get the sample from one cell, and then how we check it with PCR or fish fluorescent in situ hybridization, because we have only one cell. Only one cell. For example, here that's the results of PCR. We say, this is from Y chromosome. Okay, this is Y chromosome, Y. They have Y chromosome. They have Y chromosome, Y chromosome. So we can say embryo 1, 2, 3, 5, 6, 7, 9, 10, 11 transfer, because they are boy.
Why? Yeah.
Sorry? What did you ask?
Why? Yeah or boy?
When we have Y chromosome means boy.
Why? A boy.
Y chromosome. X and Y. X and Y. I checked this part of Y chromosome, which is this one. Understood? And when we have this part of the Y chromosome, means it has Y chromosome. When I have this band, this band, in PCR, I say, okay, this embryo has got Y chromosome. So, that's boy. Understand? For example. Sometimes this one is chromosomes. Let me ask you a question now. You don't have it. So that's the chromosomes, different chromosomes, which we can do fish, fluorescent in situ hybridization. When we transfer the embryo into the womb, when we transfer
After fertilization.
after fertilization without checking, it's not PGD, it's IVF. You are right. After fertilization, when we take a sample here, and then we have this time. What is this? Hatching. Do you know hatching? Hatch means, what's the hatching means?
Leave the egg. To leave the egg.
Break the egg.
Ovulation.
Do you understand?
Yeah.
What is the egg here? Zona pellucida. When the cells break the zona pellucida and come out, you cannot transfer to the womb. So you have just this time, about a day. 1 day you have time, less than a day. For PND you have a week, 2 weeks to give the answer. But here you have just only 1 day. Do you understand why it is very expensive? It is. So, possibility of contamination is very high. Do you know why? Why here? Because we work with one cell. One cell in the tube. Take one cell in the tube and you carry this one. Many cells on this. Is it understood? And you check who? Me or that one? The baby. One cell coming from out into that. Is it possible? Yes. Many cells around, many DNA around, coming to that and possibly contamination. For contamination, how we can understand about contamination, you have many marker on chromosome. What's the marker on chromosome means? Marker on chromosome is CTA, 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 repeats. Let me explain to you about the repeats. Do you this one? Do you remember this one?
Yes.
Okay. Here we have 4 repeats, and mother has got 4 repeats. Here, 4 repeats and 5 repeats, and here 6 repeats and 7 repeats. What about children? Say about repeats. Repeats means this one. 1, 2, 3, 4, 5 repeats on chromosomes, on genome. What's this means? Children, tell me.
5,
1, 5,
1, 7.
1, 7. Another one.
1, 5.
1, 5,
1, 6.
5, 1, 6. Another one.
1, 4.
1, 4,
1, 7.
1, 7.
1, 4. 1, 6.
4
6.
and 6. You are right. Possibly. If, look at that. If it was
8.
8, what this means?
Mutation.
No. Means it's coming from me. In PGD, but in paternity, do you know paternity test?
Yes.
Do you know paternity test? Who is the mom? Who is the father? Do you know paternity test? Unfortunately, it is increasing. Unfortunately, when I was in Canada, I used to live in Canada. When I was in Canada, we had. I saw in TV 10,000, not 100,000 paternity tests per year. Paternity test. Nobody knows who is the father. Understood?
Yes.
The meaning of that. I don't want to
Yeah.
explain a lot. Is it easy to understand?
Yes.
Who is the father? No. So, who is the age? I don't know. Who is the age? Nobody knows. Maybe mother knows. I don't know. Anyway, understood about paternity test? Do you understand about forensic medicine? Forensic medicine, who is the murderer? I get it. You kill somebody. No, you don't kill. But if you want to kill somebody, be careful, don't lose your hair, your cells on the murder. Because I can check that one. According to these marker, I can find who is the murderer. How? Because understood? Understood? So, what is called, the name of these markers are codices. That's the marker which FBI use for checking. FBI use these markers. Application for codices, application for STR. What's STR stand for?
Short tandem repeats.
Exactly. Short tandem repeats. Short tandem repeats. Is it clear? Okay. The last one. The last point is when you are working with one cell, only one cell, you possibly do PCR. When you do PCR, I don't know whether you know PCR or not. Anyway, I will explain later. When you do PCR, you have two primers here, two primers here. When you have only one cell, if during the test, during the DNA extraction, here we have a break, this PCR doesn't work. Doesn't work. Doesn't work. What this means? It means we cannot check this part. If we have a mutation here, I cannot check it. For autosomal recessive, do you know the difference between autosomal recessive and autosomal dominant?
Yeah.
You know that. For autosomal recessive, for disorder, you need two mutations. Here and here. For autosomal recessive. It doesn't matter. If you check this one, doesn't matter. Because this one can be healthy. If there is no mutation here. If mutation here and you lose it, doesn't matter. If it is autosomal dominant, means if you lose this mutation, it is the patient. So you have to repeat PGD, you have to check PGD with PND. You know PND. You have to check the results of the baby, not only with PGD, but also with PND. The only when you have problem with autosomal dominant. The difference between PGD and PGS, PGD is for pre-implantation genetic diagnosis, it means you have a symptom. For PGS, you don't have symptoms. You say, okay, check my baby. Check, I want to have a good baby without any symptom. You know, understand? Just for a screening test, for some trisomies and so on and so on. Is it clear?
Yes.
You want a quick break and again start another one? 5 to 10 minutes.